Welcome to Review for Nurses, a psychosocial nursing review course focusing on behavioral and emotional problems and coping and adaptation throughout the lifespan. Your lecturer, Sally L. Lagerquist, RN, MS, is an author and editor of 7 nursing review books and is founder and president of Review for Nurses Incorporated. This presentation was recorded live at a nursing review course. The content in this presentation is up to date at the time of videotaping. However, the National Council of State Boards of Nursing may make changes from time to time to the NCLEX RN test plan. Check their website to stay current. If there are any significant changes or corrections to the material presented here, that information will also be posted online at www.reviewfornurses.com.
The topic we will start with now is psychopharmacology, specifically the antipsychotics, also known as neuroleptics. And the easiest way probably is if I leave the podium and demonstrate some of these side effect problems. The very first one you need to know about is the most dangerous side effect, but luckily not the most frequent. It's a hypersensitivity reaction that is a blood dyscrasia, agranulocytosis specifically. The implication for nursing care is to make sure that there's a recent white blood cell count done, because that can cause difficulties. Patient will first complaint will be, nurse, I have a little sore, scratchy throat. So rather than saying, okay, we'll get a medication for it, or I'll chart it, or I'll tell the doctor, or the flu's going around, you immediately look in the chart when the last CBC was done, and nurses can order routine tests like CBC and do that. Now, the other one is skin. They burn. So you keep them out of the noonday sun, you cover them up, and you put sun protective factor of at least 30. Now let's take a look at the extrapyramidal tract symptoms. It's a trio. They look ghastly, they are common, but they're not life-threatening. The first one is Parkinson's. They don't have Parkinson's, but it's pseudo-Parkinsonism. Shuffling gait, pill rolling motion, fine tremors, drooling, difficulty sitting down, difficulty getting up, and a blank facial expression. Pseudo-Parkinsonism. The other one is dystonia. It's this, painful, tonia, muscle tone. So what's happening? The tongue is protruding. There's spasm of the clinomastoid muscle, and the eyes are going into an oculogyric crisis. It looks terrible. But the treatment for it, or the prevention for it, is Artane or Cogentin. They counteract the extrapyramidal tract side effects. Now, what's akathisia? The patient will say, my body, my insides feel like this jello. It's all shaking. I feel everything is loose and rattly inside. I feel restless. It's not nervousness, it's akathisia. Orthostatic hypotension. They stand up and keel over. Implication is, take their blood pressure. If they're in the ER and they're getting a phenothiazine medication, IM, to take the blood pressure to prevent standing up and keeling over, orthostatic hypotension. Visual changes, blurry, might last for a long time. You want to do health teaching and find out what kind of work they do. Because if it involves anything that's an instrument, a sharp instrument, or machinery, they might sever an artery or a limb due to blurry vision. So these are the most common: extrapyramidal, orthostatic hypotension, and the visual changes. There will be questions on this in a minute.